Welcome to this webinar on cancer and fertility. My name is Joanne Kelvin. I'm a clinical nurse specialist in our survivorship program. Advances in cancer treatment have led to significant improvements in survival. However, many of these treatments have the potential to impair fertility. Tonight, I will be discussing the options that patients have to preserve fertility before treatment begins, as well as those to build a family after treatment is completed. First, it's important to understand how your treatment may have affected you. Depending on the specific surgery you may have had, removal of reproductive structures may have an impact on your supply of eggs or on your ability to conceive or carry a pregnancy. The pituitary gland in the brain secretes hormones that control menstruation and ovulation. If the gland is damaged from surgery or cranial irradiation, hormone levels can be affected, which may impair fertility. The ovaries contain all our eggs, each in a tiny sac called a follicle. Girls are born with about 1 million eggs, and we lose these gradually as we age. Certain chemotherapies, as well as radiation exposure of the ovaries, may destroy eggs, potentially leading to infertility and the development of early menopause. High doses of radiation to an area that includes the uterus can cause fibrosis or scarring. This can make it difficult for an embryo to implant, and if a woman does become pregnant, she may be at risk for miscarriage or early labor. Now, of course, many women will have no problems with fertility after their treatment, but it's impossible to predict with certainty who will be affected. If you have not yet begun your treatment, there may be options to preserve fertility before treatment begins. Embryo or egg freezing is one consideration. The process begins with daily hormone injections for about 10 days to stimulate your ovaries so that a group of eggs will mature. You can see here about 5 large follicles in the ovary, each with a single mature egg. Once the eggs have fully matured, eggs are retrieved during an outpatient procedure performed with anesthesia so that women are asleep during this. An ultrasound probe is placed in the vagina so the ovaries can be seen. A thin needle is passed through the wall of the vagina up to the ovary and punctures each of the follicles to withdraw the eggs. The whole process takes about 15 minutes. The eggs are brought into a laboratory where each egg is fertilized with sperm to create an embryo. This is called in vitro fertilization, or IVF. The embryos are frozen and stored in case you need them later. Alternatively, you can choose to have unfertilized eggs frozen and stored. These procedures are performed at fertility centers by reproductive endocrinologists. Now, before pursuing embryo or egg freezing, it's important to speak with your doctor to ensure that it's okay to wait the 2 to 3 weeks that this can take, and to be sure that the hormone injections, which will increase estrogen levels, are safe for you. Egg and embryo freezing can be costly, and health insurance does not usually cover this. The cost can run between $15,000 and $18,000. However, there are financial assistance programs available if you meet certain eligibility criteria. For those of you who have completed treatment and are thinking about your options for building a family, a first step is to speak with your oncologist. Ask how long you should wait after treatment. Most patients are recommended to wait at least 1 to 2 years. This allows time for any eggs that may have been damaged by chemotherapy or radiation exposure to be cleared from your body. It gives you time to recover from the effects of treatment before undergoing the stress of pregnancy. And it allows you to pass the period of time during which you may be at risk for an early recurrence or relapse. Another question to ask is if you should be considered a high-risk pregnancy based on the treatment that you've received. If yes, your doctor may recommend that you must see a maternal fetal medicine specialist who will discuss your risks, evaluate the safety of becoming pregnant, and follow you closely throughout the pregnancy. Your success at being able to conceive naturally will depend on many factors. One of these is your ovarian reserve. a term used to describe the number and quality of eggs a woman has at any particular point in time. Ovarian reserve testing is performed by a reproductive endocrinologist. This could be considered if you're unsuccessful in getting pregnant after trying for 3 to 6 months, or if you just want to know your fertility status at some point after treatment. However, we recommend that you wait at least 12 months after treatment is completed to give your ovaries time to return to their optimal function. An ultrasound is performed to visualize the ovaries. Each of the dark spots you see in the ovary is a developing follicle. These large andral follicles are counted. In addition, blood will be drawn to check various hormone levels. Together, these tests help determine your likelihood of success in becoming pregnant. Now, based on your ovarian reserve, your reproductive endocrinologist will outline your options. If you have adequate ovarian reserve, one option, of course, is to attempt pregnancy naturally. If you're not yet ready to start a family, but are at risk for early menopause based on the treatment that you've received, you could consider egg freezing. The process is exactly the same as I described for patients who freeze eggs before treatment. For women with low ovarian reserve, ovarian stimulation with IVF may be considered. Again, the process is exactly the same as I described for patients who do this before treatment. However, instead of freezing all the embryos, 1 or 2 are transferred to the uterus to attempt pregnancy. The rest of the embryos will be stored for future use. Another option, if you're not able to get pregnant naturally, is to use eggs or embryos you froze before treatment. These would be thawed and transferred to your uterus. If you froze eggs, these would of course first have to be fertilized with sperm to create embryos before the transfer. For women who are not able to get pregnant naturally or with IVF and did not freeze eggs or embryos before treatment, there are other options for becoming a parent. One option is to use eggs donated by a healthy young woman to help someone like you. Another option is to use embryos donated by couples who underwent fertility treatment with IVF and now have extra embryos that they would like to donate. Some fertility centers have their own egg or embryo donor programs, or you can obtain these from donor agencies. Donors are screened to evaluate their physical and psychological health and to assess their family health history. The cost of using donor eggs is about $30,000. Using donor embryos is much less. Surrogacy with a gestational carrier is an option for women who are unable to carry a pregnancy. It involves arranging for another woman to carry a pregnancy for you. Embryos are created through IVF using your eggs or donated eggs, fertilized by your partner's sperm or a sperm from a donor. The embryos are then transferred to the uterus of the carrier. The carrier is the birth mother, but has no genetic relationship with the child. Most people find carriers through an agency or a reproductive attorney. Laws related to surrogacy are complicated and vary widely from state to state, so it is essential to work with an attorney who has expertise in this area. Using a carrier is quite expensive, generally ranging from $50,000 to $100,000. Adoption is, of course, another option for building a family, and having a history of cancer does not prevent you from being able to adopt. But you will need to be healthy now and cancer-free for at least 3 to 5 years. It's important to interview various agencies and attorneys to find one that you feel will support you in pursuing adoption. The cost for adoption is about $35,000 when you work with a private agency or attorney. For those of you looking to build a family after cancer treatment, this is just a very brief overview of your options. So where do you go from here? Clearly, you need to research and learn more. I've listed here a few websites you can explore, but there are many more resources based on the specific options you are considering. If you're a patient here at Memorial Sloan-Kettering, you can ask your doctor or nurse for a referral to the fertility nurse specialist to get more information. Speak with your oncologist before you finalize any plan to make sure they have no concerns based on your personal medical situation. For those of you who have completed treatment and may be fertile now, consider scheduling an appointment with a reproductive endocrinologist to evaluate your fertility status. This will help to clarify what options will be feasible for you. Investigate and plan for the financial costs involved, which may be considerable depending on the option you pursue. The legal issues with donor egg, carriers, and adoption can be complex, so you may want to schedule a consultation with a reproductive attorney if considering one of these. If you're not able to get pregnant naturally, the process of building a family can be complicated and can elicit feelings of anger, sadness, and grief. If you're finding that these emotions become overwhelming, if they persist for many weeks, or if they make it difficult for you to take the next steps, professional counseling may be helpful. We know that for some women, the process of building a family after cancer treatment can be complicated and can take persistence and endurance. However, as you walk down this path, keep in mind that many people have passed through before you and have been successful. I hope this information will be helpful as you start on your own journey.